Hey everyone, this is Ariel, the Client Service Director of Dental Nachos, and I am here with Dr. Paul Goodman, and he is going to be doing an update of questions that he's been receiving from everyone today. So here is Dr. Nacho, and be sure to reach out to me at Ariel, A-R-I-E-L, at dentalnachos.com for any questions that you guys have. I'd be happy to pass them along, and we will be doing this daily with you guys. So here's Dr. Nacho.
Thanks, Ariel. I'm glad to be here with you guys. This is a time for us to share and care and communicate with each other, connect with each other, ask questions. Things are changing daily. I'm thinking about all of you guys in the Dental Nacho universe. We're going to get through this together. We're learning more each day. Drop questions in the Zoom chat, drop questions in the Facebook Live. We'll be doing this 3:30 every day, so you guys can have something to count on for us to talk about things and share. And before I get started, I have a couple themes for the day, and I don't know if she's watching, but you could tag Paola. She gave me a really good start this. So you guys know that I am the JBN guy. I want us to be nice to each other, and that is about, do I want to do a PPO or fee for service, implant or root canal? That's for JBN. That's for us to get along and talk to each other in a kind way, even when we disagree. But some people said, oh, some of these things aren't so JBN, but we're facing an unprecedented crisis. What I've said a number of times is, when you're dealing with a problem you've never seen before, we're going to have to get a solution we've also never seen before. So Paula sent me a message that was helpful. So I want to turn JBN, which is still there if you're arguing about PPO versus fee for service, emergence profiles. But right now we really are in a JBR, just be real type of time. And I made this theme board here, and this is just me sharing with you. So I'm really into JBN for us to get along, but I'm more into people's safety. Safety trumps everything. One of my themes that you can put in is, let's do safety first, solve next. Safety first, solve next. We cannot solve without safety. So my theme from this is, safety is more important than JBN. Thanks to Paula. So JBN is for PPO, fee for service, implant or root canal, that's JBN. But I'm going to credit, just be real, Paula, B-U-C-O. I ran out of room for your name here, Paula, so you have to tell us how we spell it. But Paula is a great friend. She's the one who is doing the moderator yoga pose. She's funny. So we want Dental Nachos, the type of vibe we have here, to JBR, just be real, to have sensible, caring, but safe approaches. Everyone's opinion does matter, but let's just remember this is a crisis time, and we want people to stay home, stay safe, and stop the spread. And we're talking, even people who are sometimes against this at first are saying, listen, 3 weeks, 2-3 weeks, let's stay home, stay safe, stop the spread. Rules and guidelines are rolling out across the country, way outside of dentistry. Here in Philadelphia, where I don't think we've gotten to shelter in place yet, but we're having more stores close. Less people are not on the streets right now, and it seems like the best way to lessen this impact. So I was someone who played sports, and I was just talking with Jeff Nacho, and it matters in this game. Sometimes you're playing a game of basketball and you're down by 30 points and you think, I'm gonna lose anyway. But this game, it matters if we lose by 30 points or 23 points. Do whatever you can in your situation to stay home, stay safe, stop the spread. Even if we are going to lose this game and we have to lessen this impact, it matters if we lose by 15 points instead of 50 points. So I have here some questions, but I want to start off with something positive, something very nacho-y, how we can help. So we talked about yesterday 2 hows. Ask this question to people. How are you doing? How can I help? And I've been in situations in life where people really couldn't help me, but it made me feel better when they asked. And maybe, like I said before, it's recommending a TV show. It's recommending a new drink to try, because I am on my 1 drink a day COVID crisis, daily 1 drink a day. So I want to share with you the drink that I'm having today. 1 drink a day. I said, I'm glad to have this. My associates for the holidays bought me this for the holidays for one of my favorite shows, Game of Thrones. So I've got my straw and I have my 1 drink a day. This is the Game of Thrones Song of Fire blended Scotch whiskey. So it fits in 1 bottle. It counts as 1 drink. I'm just joking out there. So let's go to some of our questions. I'm going to go to the sheet. I'm going to go to Ariel. So is OSHA going to compile any comprehensive standards? And from the bills I've been reading today, it looks like OSHA has 30 days to come up with new standards. We want to be very aware and engaged, because I've been on the phone all day with associates, with heads of large organizations, small organizations. My own brother and I have been talking with our own team, and here's what I want to share with you. Safety first. We have to get through the earth and humanity through this. But let's talk about dentistry for a second, because we're in dentistry. And I was on with Linda Harvey, and my team will drop in the links, our awesome podcast with Rob Montgomery, Anna Hoslinski, and Linda Harvey, talking about employment issues and OSHA issues, my talk with the ADA, and also when Linda and I were on Facebook Live the other night. And here's one of our major concerns. We talked about bloodborne safety, HIV and AIDS from the past. This is an airborne virus, and OSHA and the CDC are going to have to figure out a way for all of us to feel safe going back into our dental offices. And it's going to be more than just feel. They're going to have to figure out a way for everyone. So let's just take an example for a second of what goes on with the COVID virus. So we should not be doing elective procedures. We should be doing acute emergencies only. This limits the spread. There's been a lot of talk about this. You have some questions. I'm not the only authority in this, but the ADA came out with strong language, and there's states that are now mandating this, even stronger language about what procedures would be okay to do and not okay to do. And emergency procedures are rare. They're rare. They're not somebody just with a chipped tooth. That's not an emergency procedure. So you're going to have to continue to look for updated information. I'll make the disclaimer of I'm sharing what I know. I'm not a dental focused attorney. I'm not an OSHA expert. I'm just Dr. Nacho, the sharer. But let's talk for a minute as we do, before we get to questions, about the challenge we have in dental offices. So let's say in whatever time, people go back to restaurants, people go back to salons, people go out back to their gyms, do all these things, but now they have to come back to the dental office. And as employers, we have to give our team proper PPE to keep them safe. And the CDC has to keep patients safe. So our employees safe and patients safe. So when you are using the Cavitron or drilling on teeth and creating aerosol, this smoky mist like bars from the 90s in your office, it's traveling around, and an asymptomatic carrier of COVID, you may be doing something that creates this aerosol. They may leave and be done. And what if a 70-year-old patient walks in and sits down next? What if your front desk team member has to come back to your operatory and give you a message? Are they wearing a mask? What kind of mask can we use? We should be thinking about one thing as dental professionals in the midst of this entire crisis. How are they going to make our dental offices? What type of regulations are they going to put in place? What type of PPE are they going to come out with to keep all of us safe when we go back to dentistry? So that was a question from here. Ariel, is a question from the Zoom chat so far that I can answer.
Yes, we have someone asked, why don't we cut to the chase and shorten the pain, shelter in place with no food, takeout for 3 to 4 weeks? Question mark.
It sounds like San Francisco is doing this shelter in place, and it looks like this trend is happening so that they get people to stay home and stay safe. It's a question that I watch on the news and news channels and see. It seems like it's on the table for more places to do this. One of the things that we have to talk about, and I want to bring up, is, you know who's exhausted? You know when you're exhausted at the end of your dental day, you've done 8 hours of class 2s. Imagine if they had a whole nother shift for you to do. Our hospital healthcare workers, the people on the front lines, do not have adequate PPE. They're exhausted. They're at risk. Awesome Nacho or somewhere here have family members who are doctors who are at risk for getting this, are being tested for this. So when they're taken out of the game on the front lines, guys, they're taken out of the game on the front line. Who is going to take their place to take care of these sick people? What if we do not? They talked about in length last night, the numbers, you cannot beat math, of they need the numbers of ventilators, the numbers of hospital beds. And this isn't for tomorrow. This is for weeks from now. So everything that we do today to lessen this impact means less people in hospital beds. And there's been this is a highly tense time, a highly emotional time. But if you think that this is our generation's challenge, and the way that we can help is by sitting on our couch and watching TV, that is pretty good. sitting on our couch with our family. Sometimes with your family is awesome. Sometimes it's annoying. All those things rolled into one. It's tough, but if that's what we can do to lessen this impact so those tired healthcare workers do not have to treat as many sick people, and we don't have as many sick people there, I'm willing to do that. Stay home, stay safe, stop the spread, and be willing to wait for more information. So one of the things people have said to me a lot on Facebook is, okay, Dr. Nacho, but what happens in 3 weeks? What happens in 4 weeks? We're in inning 2, to use my friend Joe Latinelli's example. We're in inning 2 of a 9-inning game. We don't have to worry about the 9th inning yet. We got to get through this 2nd inning. The answer is, I don't know. Let's play this inning as best we can. Let's play this quarter as best we can, because we want to get to this. So someone says, what happens if we're shut down for 3 months? I don't know. I don't know. But right now, let's do whatever we can to get back to healthy living, dentistry, all the things that annoy us on a daily basis, like class 2s. That's what we want to get back to. Another question is about employment from owners, okay? So we talked about, can you please clarify how to handle PTO and sick pay if we have our employees go on unemployment? This is happening today. Bill just passed about relief for small businesses, but are dentists exempt? Are dentists not exempt? We have great people on this group on Facebook that we can ask these questions to try to interpret this bill. My interpretation as a business owner, if I was reading and listening, was, okay, your team starts to go on unemployment because unemployment can take care of your team, and you can maybe use whatever you've left in your account to take care of other bills that you have. We're thinking that. But then the government says, okay, small business owners are going to have to give or have to provide PPO to their employees. But remember, I used this example yesterday. If the moderator came to me right here and was like, Dad, for us to solve a problem, you're going to have to dunk on an NBA regulation rim. I can't do it. I need another way to solve it. So if the government is going to ask small businesses like dental office to pay out 2 weeks of sick time at the same time, they're going to have to provide the funding for us to do this, because for dental offices across the country, for most of us, it's like dunking a basketball. Yes, maybe there's some dental offices that can rise up and throw down a 4-week payroll dunk, but it's not going to be the norm for dental offices. And WAITT, we are in this together, and we're going to have to keep looking and keep watching and figure out how the government is going to do this for small businesses. And we don't know. I see other places are having webinars. I encourage you to jump on webinars and learn. One of the things I'll share, and one of my friends this morning here who's done our stress reduction course, Dr. Shakila Angadi, who's just an amazing human being. We did a great stress reduction course. And how do we balance engaging our brain, engaging our phones, okay, with this crisis, and also taking care of ourselves? And it's tough. It's tough. So maybe you have to figure out a way to take mental breaks, get good distractions, do some things, but also keep your ear and eye on stuff that's going on. Because if you're leading a team or you're a team member, we're all in this together. And we have to figure this out together. One of the things I will encourage you guys to do is, if your colleagues are not sure if they should shut down yet to elective procedures, kindly annoy them to do so. Safety trumps JBN. Say, if you hear someone saying, I'm doing veneers, prepping teeth, it's no big deal. It is a big deal, because when they're spreading this COVID virus to people who don't know. The other day on the news, they said 4 to 5 people who got the COVID virus got it from people who didn't know they had it at the time. That's very, very scary. This data is coming out day by day. We just have stories. We don't have studies at this time. I'm going to continually tell you that I'm Dr. Nacho, doctor of nachos, okay? Not epidemiologist, but sharing stories and creating an opportunity for us to talk. Ariel, any questions since that time? Yes.
I have one. They said, I'm in Idaho. Our state/cities have not been hit hard, ... yet. I have followed the ADA recommendations to close except for emergency cases. What can I do to help those dental offices around me that are still open and treating routine patients understand the importance of following recommendations given?
Great question here. If you're in Idaho, you're lucky. Keep the numbers down. And I would call up your colleagues, ask to talk to the owner, and just say, hey, I know we're not a field where we get along and do stuff, but I'm here to tell you that there is a call for safety through the dental community. We have so many patients that would come in on a daily basis, and start thinking about we instead of me, because we don't want to have to wait for mandates to do the right thing. I shared with you, the expert on Ebola said, if we wait to get it right, it's too late. If we wait for the government to come and rip the drill out of our hands, it's going to be too late and we're not going to get back. A couple weeks of production is not worth it to preserve practices long-term. And already, do you want to be the office that's associated with having COVID from your office? Do you want to be doing elective procedures and have your team get it? Put aside for a second, now your team is sick. Someone's sick on your team. You may need to self-quarantine. Is that the reputation that you want at this time? And I would say that's a very dangerous thing to do. So I would kindly annoy your colleagues. It's not easy. Look at me. I annoy people all the time. I figure a few more. What's the big deal? It's tough. I get it. But just say, this is the thing. You know who you're being JBN to? So some people have reached out to me and said I've done some great things. Some people have also said some things about me my grandmother Baba would not have liked. It's okay. I'm going to do what I think is best anyway. But what I will share is the people that I'm being JBN to by annoying or kindly annoying dental offices to shut down to elective procedures. I'm being JBN to those patients who are unsuspecting. I don't know them, but I care about their safety, not the dentist production. You can always make money later. You can't get back your health. You can't buy a new body. Great question there. Okay, let's go. Is there unemployment benefits for the owner dentist? Great question for your accountant, your CPA, and it depends on the structure of your office, it sounds like, and it might be tough. I've never heard of a dentist getting unemployment for owner dentists. Associate dentists who are W-2 employees, 1099 might be a problem because it's very rare for an associate dentist to truly be a 1099. But for W-2 employees, my belief standing here in this moment could change tomorrow is that associate dentist applying for unemployment so you can take care of yourself is a reasonable thing to do if your office is not going to be open for the next 3 weeks. I was on a call with an associate dentist. So I wish I was closing our office to go back to Positano with Mrs. Nacho and have limoncello. That would be fun. But if I decided to close my office for 3 weeks and said, this is the trip of a lifetime, guys, we're closing and then we're going to open up in 3 weeks, my team, my staff could apply for unemployment because the office is being closed through no fault of their own. The office is being closed through no fault of their own. But I was talking with Jeff Nacho. Hamilton is one of my favorite plays, and you see that battle between Hamilton and Jefferson, federal government versus states' rights, and the federal government has said to be very relaxed about a lot of these unemployment rules, but I would consult your accountant. Ariel, any other questions on your end right now?
Yes. How are our insurances shorting us in this dire time? They are preemptively saying they will not cover.
Is this just for clarification? They could type in, are you guys for insurance company concerns? Are we talking about dental insurance covering procedures? Are we talking about business interruption insurance? Are we talking about liability insurance? They can type that in. I'll come back to you, Ariel.
Okay, I'll wait for them to type it in.
Let me just go through a couple more things here. What can we do to help? Okay, so one person said, I'm not going to make this about DSOs or private practice because I have seen solo practices and places with hundreds of practices behaving in awesome ways. DSOs being awesome and private practices being awesome. Doing the right thing, stay home, stay safe, stop the spread. I've also seen all those practices, solo practices, DSOs, not being so awesome. Running ads and saying, come in and get these things done. Come in and get your prophies, things like that. I have kindly annoyed some of these places myself and done some good. One owner that I spoke to today seemed to be not happy that I made him aware of the danger to his team. Whatever gets you to shut down and be safe, that's good with me. You want to be safe and protect your team? Awesome. You want to protect yourself from liability? Also awesome, okay? You want to protect yourself from a potential problem later? Also awesome. Whatever gets the results, like my business coach, Terry Brock or Aldana Ambler would say, whatever gets the results in this crisis is good with me. But when I explain the Aerosolist show, I actually think, please drop in the link, my conversation with Linda Harvey team, and also the podcast. You guys need to listen to this and see the true challenge of having an airborne virus, which we don't have a vaccine to, that is stimulated through what we do as dentists. This isn't what restaurants do. This isn't what hair salons do. This isn't what the Apple does. It's what we do, and we need to solve this, and we have to have attention on this because this is something that's unique to dental offices. Now let's take a break, and Mrs. Nacho, you can take a break from our other live because I want to bring Mrs. Nacho on and say, how can we help? So we talked about my awesome friend, Dr. Shakila Angadi, sharing with us about managing stress during this time. My team can also put in her course that you can get for free about managing stress in general. She has shown that we need to be aware. People are making homemade masks. Doctors are being called to the front line. There's a dental nacho who's in the military reserves being called in for this. This is serious. It is a serious thing. So what can we do to help? So besides sitting on our couch in our sweatpants, which is something I do quite frequently, I like Netflix, Amazon Prime, things like that. We also can take our PPE, which is masks, face shields, disposable gowns, eye protection. There's plenty of PPE sitting in our offices that we can donate to the front lines. Before you freak out, don't donate all of it. Grab one thing. All of us, Dr. Todd Fleischman and Mary are going to come, and Mary's going to talk about what they're going to do. So I'm going to let Mary jump on.
Hey guys, we're excited about being able to do something to help out at the hospitals. We've been following the developments on TV and reading about it, and also stories we're hearing from our friends who are nurses, sharing what it's like there, and people making the masks out of scarves, and stopping at Home Depot to try to make whatever they can to stay safe is really horrific. And it sounds like it's just going to get worse and worse here in Philly. They're kind of running out at the local hospitals. So Todd had a great idea that we wanted to help make happen. It's something that all of you can do for your local hospitals in your hometown, organizing, just donating maybe one box next time you go to your office, check the mail or whatever, grabbing a box of whatever you can. And yeah, we're developing how we're going to do this exactly. Email me at mary@dentalnachos.com and we'll send you the information about where you can drop off. For us, it'll be here local in Center City with the help of Todd Fleischman, getting it to our local hospitals.
Great. And we also have other awesome nachos, like one who was my resident, and I just was at the New Dance Boost Camp, and I was making fun of her for eating too much candy. I wish we were back at those times. But Baljeet and Stephanie, also a resident, are doing some things. There's plenty of places they can put that in the chat. Nacho team, make sure we get that in the chat. Baljeet and her crew are also looking for donations. Here's what I think is best. Results matter, okay? All of us are going to have to run the lines, water our plants, check something at our office. We're going to have to do that. Somebody, when you go and do that, grab one thing of each, grab two things of each, and get that away, whether it's through what we're doing, a Dental Nachos production of True JBN. Get this together and reach out to the people doing this, whether it's mary@dentalnachos.com, anyone who's doing this here, put your contact information in the chat, but mary@dentalnachos.com is great to email about that. If you're somewhere else, not in Philadelphia, and you want to get this organized, Mary will help you also. She makes these really great canvas. You can put them on Instagram. I think, remember, how are you doing and how can I get help? I've been in a lot of tough personal situations, and I liked when people asked that to me, even if it was just a small thing. Can I get you a Starbucks? Can I recommend a movie? And in our situation, a small thing, taking some of the PP in your office and donating it to hospitals or people on the front line to help keep them safe is awesome. Any other questions there, Ariel, that we didn't get to chat?
Our insurance question was about corporate insurance.
Well, these are things, I mean, I live this life as a practice owner. So right now, our business interruption insurance, I'm not sure if it covers pandemics. It's quite crazy to be saying that. I didn't know you need to ask if it covered pandemics, but business interruption insurance, you have to check with that policy. We talked about that on the podcast. Our dental insurances, here's the thing. This is where I'll say, I mean, this whole thing is really me sharing my thoughts. It's not like I'm doing a study here at Nacho headquarters. I'm watching the same news. I do get a chance to talk to some interesting people behind the scenes, asking questions, learning. I did get to interview the ADA. I'm going to look to do an update. My Dental Nachos team, please email them because people have asked for an update because Oregon is shut down for 3 months. That's a whole thing, right? What's going to happen to their dental offices? So Dental Nachos team, please reach out to the ADA and offer. We would love to do an update with them on Monday or Tuesday of next week. That first one went really well. And I think we'll have more information. They are lobbying for us for relief for dentists and working on that for us. They're the best we have at this time to work with Congress and work with the CDC and work with OSHA to get this done. Business interruption insurance, look at your policy. Dental insurance. So guys, we can't say just because it's not a mandate, we don't have to act. So right now, if you're doing dental care in your office, I'm assuming the dental insurances have to pay for it. I'm assuming right now. Is that going to change? If they come out with mandates and you try to build dental insurances, what's going to happen? These are all TBD, me sharing my thoughts as to some concerns that might think are happening. I got to do about 5 or 10 more minutes here. If you're thinking of a question you really want to ask, let me know. My office is working 100% full go. If I say no due to lack of PPE, can I be fired, or what legal ramifications? I'm going to say this, and this stinks, and I talk about this on Facebook chats. My team can tell you how many times we get these questions. OSHA requires your employer to create a safe work environment with the proper PPE. If they are not creating a safe work environment with the proper PPE, masks, face shields, disposable gowns, things of that nature, then it's up to you, and you have the right to say my employer is not creating a safe work environment. This has nothing to do with COVID and has everything to do with keeping people safe all the time. So remember, as an employee, if you refuse to work in an unsafe environment, there's protections for you. As I'm standing here, I am not a dental focused attorney. So yourdentallawyer.com, Rob Montgomery, my kind friend, Dental Amigos podcast partner, if he can't help you and his team, they are a good resource for someone else to help you. Yourdentallawyer.com. I did get a call today from a associate dentist who is being asked to sign an amendment to her contract by the end of the day under the act of God. It sounded weird to me, and I referred her to ask Rob Montgomery. So if you need to sign something and your employer says you need to sign this so we don't have blah, 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 ask before you sign. Super important there. And let's see, the Q&A section. Let me check here for you guys. If you have a W-2 as part of an S-Corp, can the owner apply for unemployment? I definitely would say, I would try to do that if that was the case and talk to your accountant. Dentists are doing the right thing. No one's supporting us financially. That's a really good point. But here's the thing. One of my best friends in life is an amazingly smart guy, works at a hedge fund, someone who I go to for advice. And he said the other day, we're all going to have to share in this pain. And I get it. It's pain. We're all going to have to share in this pain. Big companies, little companies, somebody works at a restaurant, somebody works at a hair salon, dentist. And I will encourage you to be patient, ask good questions. And I'm worried too. I have 2 dental offices, 20 employees. I want us to remember that if you're safe right now, and if you have money for today and your family's safe and you can say yes to these 3 things, not everybody can say that right now. And to try to keep that in perspective, and I know it's hard, and the same thing happens to me. Hopefully they will look to help dentists along the way here, because we all have people we have to pay. So if someone can't pay their rent and they can't pay their landlord and the landlord can't pay their mortgage, they were talking about this last night in the news, sometimes it starts at the bottom and starts to trickle up. We're going to have some very creative solutions, which the government and our leaders are going to have to come up with. As dentists, I encourage you to do whatever you can to manage your business in the best way possible. Keep in contact with your employees and team members. Start to make a list of the vendors and people you have to pay. Perhaps there's times for you to ask for an extension. One of the things that I shared was, we can't abandon everybody at once. So if you shut down all of your services, if you have a $39 service and you say, I don't want to pay that tomorrow, and if that company runs on $39 services, it's going to be really hard for that company to stay in business. And you want that company when we get back to business. So one of the things I'll share here at the end is what I think is a good idea, because creative problem solving. Let's say you have a vendor charges you $47 a month for XYZ. Nacho delivery, $47 a month for nacho delivery. Okay, that's probably what we spend here at Dental Nachos, maybe more. But 40, and you say, I don't want to pay you anymore. I don't want any nacho delivery. We're having a COVID. And if everyone said that, the nacho delivery place wouldn't be around when we go back to business. So one of the things I would say is, how about this? How about I pay you this $47 for the month, right? Whether I get my nachos or not, we have all these things. And how about you give me a free month later when we get back to business? How about you give me a free month later when we get back to business? That's sometimes being a kind customer. We're in this together. Creative problem solving. If we shut down everyone we pay, they're going to shut down everyone they pay. And I know it's hard, and it has to be done. Situational leadership, customized decision-making. Someone who might be on here who's been a great person to have around, he said his gym asked if they could still pay for that month so they could pay their employees. And that's transparent. And I get that. So if my gym said, can you pay us $59 for this month so we could pay our employees, I might say, you know what? I'm going to pay the $59, but how about this? Will you give me a free month to be named later? When everything settles down, would you give me a free month to be named later so you can get through this? And that's just my message to you. Situational leadership, customized decision-making, stay safe, stay safe, stay home, stop the spread. And like Paula said in messages, as much JBR as possible, just be real. If you need to reach out to us, salsadentalnachos.com. I'm going to let Ariel come on and just tell you how you can reach out to her. Also, I've learned once we shut down Zoom, all the comments go away. So I will turn off my video. I will turn off my sound, and you guys can talk in the comments. Ariel will talk. And I want to share with you every day. We're going to do this at 3:30 p.m. Ask questions, talk, share. Doesn't all have to be about COVID. We can start to talk about things that people are doing to relax at home. We can start to talk about things that people want to do when they get their office back. We can start to talk about cool things we've learned. Keep it positive too, but 3:30 p.m. Eastern every day so we can talk together. This helps me, so I appreciate you guys being on here for this. And we use an email system. Okay, so we're running a complimentary broadcast of CE on TV every day. Okay, so we ran Dr. Todd Fleischman's amazing course today, Endo yesterday. The only way for everyone to get updated of when you can sign up for these things is through our email list. So we have a landing page to be on the email list. Maybe you don't have an email person, join for this time, then drop off later if you want. But if you want to get a break, some complimentary CE, some resources, some podcasts, Ariel and her team are going to be sending out a daily email with links for you to sign up. Maybe you want to share them with friends. So you can just sit there with your one drink of the day and watch Todd Fleischman do his magic. Watch Mark Costas share about how to do systems. I want to create this way for you to watch in on stuff as one of the things that we do. All right, awesome, guys. I appreciate it. Have a good rest of the day here. Stay safe, stay home, stop the spread. I'm thinking of you guys.
Hey everyone, this is Ariel, the Client Service Director of Dental Nachos. Our team is working hard to help Paul with the overflow of messages and concerns. So please email us at salsa@dentalnachos.com, or you can email me directly at ariel@dentalnachos.com, or you could text us at 267-896-4886. I'll drop all of that information into the comments, and I hope you all have a good rest of your Friday.